I'm Dr. E.D. Prasad, and I'm a general surgeon, laparoscopic surgeon, and also a vascular surgeon, practicing at GVK Health Hub, operating here and taking care of multiple surgeries, including diabetic foot and all the daycare surgeries whichever patients need. We are operating here in our theatre, and we are completing the surgery and sending the patient home immediately so that they don't have to stop their work and they are able to continue their routine work. The first thing is, in a patient with diabetes, if his diabetes is under good control, the wound heals very well. The other thing is, if he is not having any habits like drinking alcohol or smoking, the vasculature is better for those people. If they avoid these habits or stop it, the healing is much better. It's basically the involved part of the body where the wound is. If the blood flow is adequate or good, then the wound will heal much better and they don't have to go for amputations. Amputation, which is removing of the part which is not needed, either toe or leg, can be prevented if the flow of the blood is good. See, in a diabetic patients, he gets multiple issues or problems. He can have gallbladder infection, appendix, or ulcers in the stomach, or so many other surgical issues when he has. When we operate, instead of cutting the body for a large area, we can use laparoscopic procedure where the tissues are cut very little and the involvement of the body with hands is less and the recovery period is much faster. So when laparoscopic procedures are done, patient's recovery time is fast. They can go home sometimes even by the next day itself. What happens is, in summer, in our Indian scenario, patients tend to sweat a lot. So because of that, the infection rate is little more higher than normally in the winter time. And recovery also is faster during the winter time because they don't get dehydrated, the nutrition is good, and patients are comfortable. So that makes a lot of difference. Although if the emergency occurs in summers, we have no other choice but to take care of him, but with little more precaution. Now with the things of hospitals having air conditioning, that issue of sweating will not be much during the operation time or during the immediate recovery time. When they go home, these things may be little different. When we talk of diabetic patients, most of the patients have ulcers. The commonest ones are ulcers, gangrene. So these are the problems that we face, and the patient is worried that he is losing a part of his body. So that is a big challenge for the patient. So if the infection is there, if the bone is already infected, tissues are gangrenous, then we have to remove the necrotic or dead tissues, and patient has to accept it. So the patient has to have patience for the treatment. Doctor should have patience to treat it for a long period of time. If you want to save a foot or a limb, it takes long time. So for that, patience is needed. Surgeons, patience is needed. So it takes a long time, but the results are good. If the vasculature blood flow is adequate, definitely the wound will heal.